hot topic around southern Wisconsin right now is the air quality.
Or the lack thereof. The smoke from Canadian forest fires are now blanketing our area, actually reaching the ground. UWL's Chief Quality Control Officer, Dr. Pothof, is here. Thank you for being with us today. How much of a health threat is this smoke right now?
You know, for most people, I think assuming people are doing normal things like, you know, going to work, maybe running some errands, I think most people will tolerate it okay. But there is a subset of the population, especially those with underlying medical conditions, certainly respiratory problems, asthma, COPD, but even folks with, you know, advanced heart disease, risk for stroke, where this could create, you know, more significant problems.
So I was just talking to you about my Geo. He has asthma as it is, but we roll on the window for like a hot second and he starts sneezing, and then it almost looks like he's getting like an allergic reaction to something, almost like peanuts or whatever. So it's like, what is in this?
Yeah, so it could be that there's allergens within the smoke, but even the smoke particles themselves are pretty immunogenic, meaning they stimulate your immune system to have a response. And that could manifest as difficulty breathing because there's inflammation in the airways. It could manifest with reactions, rashes of the skin as the immune system starts to attack that stuff that's in your blood. And that's where it's hard to predict who's going to have a more robust reaction versus not. So, you know, the overall safest thing to do is to try to stay inside, windows closed, but that's not that practical. If you are going to go outside, if you have an N95 that's tight-fitting, that will prevent you from breathing these particles. That's helpful. Or at a minimum, try to minimize how long you're outside or how much you're exerting, so you just take in less of those particles than you otherwise would.
Well, actually, some bunch of guys that are working outside, construction guys, working outside all day long, exerting themselves. That can't be good for them.
I mean, some people will do absolutely fine with that, but as these particle concentrations get higher and the air warnings get a little bit more severe, the percent of people who are going to have symptoms starts to increase. So some people will get away with it. They'll be like, well, that wasn't so bad. Someone else is gonna be like, boy, that was a really rough day. I'm coughing, I'm sneezing, my eyes are itchy. It's just hard to know who's gonna have it and who's not.
So I have to walk the dogs.
Yeah, I was gonna say, what about the dogs and the animals?
Yeah, I think what I've been telling people is, you know, if you want to take your animals out, things like that, certainly this isn't the day that I'd, you know, play catch with your dog, throwing the tennis ball and have him run around 100 miles an hour. But, you know, a regular walk, if you have asthma, COPD, make sure you have your inhalers with you. And if you really want to keep yourself from getting exposed to it, just throw in that N95 for the duration of the walk and call it good.
Another topic, what about this new statin alternative?
Yeah, this is a report out of JAMA, and the medicine we're talking about is benzoic acid. If we look at cholesterol, a lot of us will have elevated cholesterol as we get older, and that cholesterol creates plaques in our arteries that then rupture and cause heart attacks and strokes. That's bad. So we have medicines for a long time called statins. So things like Lipitor, Crestor, I think a lot of us are familiar with that. Unfortunately, a small amount of the population, 15%, 20, so maybe not that small, will get muscle breakdown when they take a statin, and then they're kind of left out there not being able to manage their high cholesterol. This new medication won't cause that muscle breakdown. It doesn't reduce cholesterol quite as much as a statin, so it's second line, but it provides some protection, some reduction in cardiovascular disease compared to those folks who before really didn't have much they could take.
Is this something that a doctor will hopefully tell you about, or should you bring it up with your doctor your next visit, or maybe you might chart them now?
I think if I'm someone out in the community, I'm like, what's going on? I would ask my doctor, hey, talk to me a little about cholesterol. What's my cholesterol level like? Lots of times we can reduce cholesterol through lifestyle changes, increased exercise, better diet. When that doesn't work, we start talking about medications. Statins are first line, but for those folks who don't tolerate it, this is a second line. This is something you want to talk to your doctor to get figured out.
Let's have an alternative.
Yep.
All right. Thanks for being with us today.
Yeah, you bet.
Breathe easy out there.
Yeah.
Thank you.